Alright, so moving on to the elbow. This is my cousin Oscar. I'm going to do all the elbow videos on him as well. So this video is going to include inspection, palpation, active, passive, and then resistive range of motion. So first I'm going to start with inspection. Before that, sir, does any elbow bother you?
No, sir.
No? Okay, so I'm going to inspect his elbow, shoulder, mostly his elbow. What I'm looking is for redness, perhaps muscle atrophy, any pathology such as like a cyst or something else going on. Next, I'm going to move into palpation. Since he said that nothing bothers him, I'm going to start with his left elbow, but always remember to start in the non-involved elbow. And if he said, for example, here, it hurts right here, start away from the pain, then move into it. First, you want to do temperature. So, you know, you're looking for temperature change bilaterally. His elbows are significantly cold, which I don't know what to think of that, but then we're moving on to palpation. We start with bony structures such as the medial lateral epicondyle, lectern process, the cubital fossa right here, cubital tunnel, radial head. Moving on to deep palpation on soft tissues where the tendons attach, all of those bony structures as well. Did any of that bother you? Do the same on the other side. Remember, palpate those tendons, so you want to move a little up as well, not just the elbow, and down as well. Okay, so then I'm going to be moving on to active range of motion. For the sake of time, I'm going to do it on one elbow, his left elbow, but remember, always do bilateral. So first do one side, then do the next, and you want to compare, okay? So, I'm actually going to do this one first. Go ahead and extend your elbow like that, palm up. Okay. So we line it up. One hand goes to the radial styloid, the other one mid-humerus, and he has 0, which is normal for a guy. And normal is from -10 to 10. And then flexion. So flexion, go ahead and hand like that. And then what I want you to do is bring it all the way forward like that. Perfect. Is that all you can, or can you go more? There you go. Okay. So he seems to have 140. 140, which is also normal. 140 to 150 is normal for flexion. Getting my inclinometer. So next, I'm going to be doing supination and pronation. So what I want you to do is put your arm like this, palm down. Now turn it up like that. Perfect. Okay, what I want you to do is bring your palm down. No. So move it. So move it like that. But palm, open hand. Yeah, there you go. Bring your hand down. Wait, not yet. Put it back in. Okay, bring it down. Oops. Let's do that again. Go back to neutral. Gonna zero that out. All right, go ahead. Perfect. And he has 90 degrees. Can you go more? Nope. All right, that's fine. Now go ahead and bring it back to neutral. I'm gonna place it on this side. Okay. I'm gonna zero it out. Let's do that. When I tell you, let me do that. All right, go ahead. Perfect. All right, so 80 degrees. Normal is 90. Did any of that bother you at all? So now I'm going to move into passive range of motion. I'm going to be doing those movements for you. Relax. Does that bother you? Does that bother you? All right, this feels bony. This feels soft tissue approximation. Pronation. Tissue stretch. Supination, tissue stretch. Does that bother you?
No, sir.
Perfect. Now I'm going to move into resistive range of motion. So what I want you to do is bring your arm like this. Now try to push it forward. Okay? Does that bother you?
No, sir.
Alright, now try to bring it back. Does that bother you?
No, sir.
Good?
Good.
And then try to bring your palm up like that. Okay? Try to bring it up. Does that bother you?
No, sir.
Now try to bring it down. Does that bother you?
No, sir.
Alright? So, he's good. And again, you want to do that bilaterally, starting the non-involved side first. Okay, so this is called the Cousins test. Does any elbow bother you at all?
No, sir.
No? Always start in the non-involved elbow first. I'm going to palpate the lateral epicondyle. I'm going to be moving your arm around. Let me know if you feel any discomfort, okay? Okay, so what I want you to do is put your arm like that. Perfect. I'm going to be pushing this. Try to keep your wrist flexed, okay? Or extended, rather. Alright? Does that bother you?
No.
Alright, we're going to do the same on the other hand. There you go. And does that bother you?
No.
So, pain at the lateral epicondyle would be a positive test. This test is for lateral epicondylopathy or lateral epicondylitis. Alright, this is Mills' test. Sir, does any elbow bother you? No? So remember to start in the non-involved side. And then I'm going to do all the work. I'm going to be moving your arm around. Let me know if you feel any discomfort, okay? Alright, so Mills' test. Palpate the lateral epicondyle. His elbow is flexed to 90, hand is flexed all the way. I'm going to extend your arm while keeping your hand flexed. Alright, does that bother you at all? No? Going to do the same on the opposite hand. And extending. Does that bother you? So pain at the lateral epicondyle is indicative of lateral epicondylitis or lateral epicondylopathy. Okay, so this next test, it's called the golfer's elbow test, also known as the medial epicondylitis test. Sir, does any elbow bother you at all? No? Okay, so I'm going to start with this elbow. The starting position is the same as the Mills. I'm going to be moving your arm around. Let me know if you feel any discomfort. So I'm going to palpate the medial epicondyle here. And then I'm going to extend the elbow, extend the wrist. Does that cause you any pain? No? Okay. I'm going to do the same in this hand. Palpating the medial epicondyle. Does that cause you any pain?
No.
No? Pain at the medial epicondyle is indicative for medial epicondylitis or medial epicondylopathy, also known as golfer's elbow. Okay, so this next test, it's called the ligamentous instability test. And what I'm going to be asking you to do is go ahead and extend your arm. I'm going to be moving your arm around. Let me know if you feel any discomfort, okay? All right, I'm going to slightly flex this elbow. Actually, can you go ahead and turn over here? No, perfect. Merci beaucoup, monsieur. I'm going to flex slightly the elbow, feeling that joint. And what I'm going to do is apply a vagus stress. So hold this motion. I'm going to apply a vagus stress. And then I'm going to come this way and apply a varus stress. And gapping or abnormal movement would be positive and indicative of either a medial or lateral, aka radial or ulnar ligamentous sprain or tear. Alright, so this next test, it's called the elbow flexion test. Sir, do you feel any pain in either elbow? Any numbness?
No, sir.
Any sort of tingling?
I promise I don't.
Okay. So what I'm going to ask him to do is go ahead and flex, bring your elbows, flex them to 90 degrees. Hands, palms like that. Flex, so yeah, flex all the way. Palms like that. And then I'm gonna ask him to hold this position for 3 to 5 minutes. For the sake of time and for the sake of this video, I'm gonna stop it right here. However, if he feels pain, numbness, or tingling sensations, or like needles around the ulnar distribution, which is from here all the way here, that would be a positive test, and it would be indicative for cubital tunnel syndrome. Okay, so this is called the Tinel's sign of the elbow. Okay, so does any elbow bother you at all?
No, sir.
Do you feel any pain, numbness, or tingling?
No, sir.
No? Okay. So what I'm going to be doing, remember, I always start in the non-involved side, but he said no, so I'm going to start in his right arm. Thank you very much. So I find the olecranon, medial epicondyle. Go ahead and relax, flex your elbow. Yeah. I'm going to go in the middle of it, a little bit distal, pretty much below the ulnar groove, and then I'm going to be tapping with it. Alright. Did you feel any pain, numbness, or tingling? No. Or at all? Okay. Doing the same thing here. Finding the olecranon, medial epicondyle, pretty much middle to it, down. Alright. And relax your arm. Relax it. There you go. Alright, did you feel any numbness, tingling? No? Okay, if he felt pain, numbness, tingling, needles, paresthesias, pretty much, that would be indicative of cubital tunnel syndrome or also nerve regeneration. Alright, so this next test, or this is called the cubitus carrying angle, this is the carrying angle measurement. So what I'm going to ask you to do, simply go ahead and extend your arm, palm up, pretty good. So I'm going to put the center point at the center of the joint line, and then the one arm goes in between the mid-humerus. Thank you very much. The other arm goes in between the radius and ulna, and his carrying angle for his right arm is 6, which is normal. Men have a carrying angle of 5 to 10 degrees. Women have a carrying angle of 10 to 15. I'm going to measure the other arm. Go ahead and do the same, please. Thank you very much. And yeah, 6 as well. So that's normal. If it was greater than 10 for men or greater than 15 for women, that would be indicative of cubitus valgus. If it was below 5 for men or below 10 for women, that would be indicative for cubital varus. Yes. All right. Thank you.